Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, I have Anna Gomez del Campo with me. She is the CEO and co-founder of Surefhir. Welcome to the show, Anna.
Thanks for having me, Dr. Roxy.
So I always like to start off with you giving our listeners and our viewers some insights about your background and what innovation you've been working on.
Sounds good. So I'm a biomedical engineer by training, and I kind of fell into digital health serendipitously. But my area of interest is in how do we use human-centered design to optimize processes in healthcare and make life safer and easier for patients and providers. So the innovation we're working on now is called the patient journey map. Our basic thesis is that because EMRs have a billing-centric view of care, it makes it really difficult for providers to put together the story of who's taking care of the patient, what did they do, and when did they do it. And that leads to situations where they're forced to make simplifying assumptions and say, you know, I'm sure somebody else took care of that. I'm sure pulmonary medicine is managing the antibiotics. I'm sure somebody else already started the discharge process. I'm sure somebody else, you know, you kind of get the picture. There's very little there's lots of cooks in the kitchen and very little transparency across all of those players. And so our answer to that is to say, let's take the billing-centric view of care and put an EMR overlay that transforms that billing-centric view of care into a clinician-centric or a journey-centric view of care. So every event, every note, every order, every medication administration gets organized in the context of who did it. So if I'm a hospitalist, I'm coming on service, I want to know where did the last person in my role leave things? I can look at the hospital medicine timeline and see exactly what are the last things that happened. Or I can look at the pulmonary medicine or nephrology timeline and figure out, okay, well, what problems are the consultants managing, or what problems are the consultants not managing because they think somebody else is supposed to be managing them.
Right. So how did you even come across this problem that needed to be solved?
Great question. So I mentioned I kind of fell into digital health serendipitously. While I was still a student at Georgia Tech, I had the chance to collaborate with some of Grady Health System's top leaders in informatics. And the purpose was to work together with them to build some proof of concept applications to solve clinical workflow issues. And so that's where I first encountered the problem of, you know, it's really difficult to actually know who's taking care of a patient at any given point in time. And, you know, I've told that to people outside of healthcare, and they're like, no, how could a hospital not know who's taking care of their patients? And I'm like, yes, that can actually.
Nobody wants you to know that, but it's happening.
Nobody wants you to know, but it's happening. And so that was kind of that problem really intrigued me, because I was like, how could we not know something so basic? How is there not an existing process or mechanism that's robust enough to track changes in responsibility? And as the more and more I looked into that problem, I realized, you know, the transition to team-based and shift-based healthcare hasn't really been addressed with clinical workflow tools. We have all of these new complexities, but the technology hasn't really kept up with them.
So where are you in the innovation process now?
So we've got
before COVID.
So before COVID, things were awesome. We had just pitched a big Atlanta health system doing a pilot. We said our pitch to them was, hey, look, we have this concept. It's called the patient journey map. here are some of the use cases. We really think it's going to help with patient safety and throughput. We're looking for a strategic development partner because this is sufficiently sophisticated that we can't build it in a vacuum. We're looking for a development partner. And the executive we were pitching to is one level below the system CEO, said, that's great, as long as the clinical leaders who report to me like it and the operations leaders who report to me like it, we'll move forward. And so then we presented to the clinical leaders and the operations leaders, and there was consensus, and they said, okay, this is great. The only thing we have to figure out now is which hospital in the system are we going to deploy it at? And this was about 2 or 3 weeks before the lockdown hit.
Uh-oh.
So the trouble with working with the key clinical and operations leaders is that when a global pandemic hits, the people who are hardest hit are the clinical and operations leaders. So we're in a situation right now where, we don't think we're dead in the water. We're on pause, but our executive sponsor, even his direct reports, can't get meetings with him right now.
Right.
And
it's chaos.
So we're like, okay, once his direct reports, who we still have a very good relationship with, can get meetings with him, then we'll know that things are starting to get back to normal. But since then, it's given us some time to reflect on, okay, what are our value propositions? What's our business model? Are they still going to make sense in this environment? And what can we do to make the sales cycle shorter? Safety and efficiency is great, and it's definitely still important post-COVID. But is there something we can do where it's immediately going to help generate revenue or capture more reimbursement?
Yeah. So, what was that process like over the last few weeks? Wrestling with those different scenarios, especially, I imagine that you're also not face to face with your team. So
right.
you're kind of working through your pivot strategy virtually.
Exactly. So, the short answer is depression and anxiety inducing, but I can tell you about some of the more interesting conversations that we've had with the stakeholders that we have been able to get on the phone. And right now we're trying to get a combination of, fresh stakeholders, people who don't know us, who aren't as, who maybe aren't going to be as biased by the fact that they like us.
Yeah.
To tell us about what their priorities look like now. So I had a conversation with a hospital chief operating officer in Connecticut, and I was asking him, how have your priorities changed now versus pre-COVID? And he said, it's interesting. We haven't talked about Claudies or Clamsies in 6 weeks. All of these kind of publicly reported outcomes are just not a priority anymore.
Yeah.
Interestingly, throughput has leapfrogged to the top of the priority list and almost above everybody else. And I was like, that's kind of weird. Isn't your hospital half empty? And he said, yes, but people used to be complacent about letting the patient stay, an extra 2 hours, 4 hours a day in the hospital. But now it's not acceptable to leave a patient in the hospital lest they catch COVID because they stay here for an extra 15 minutes.
Yeah, it's too risky.
It's too risky. And then so there's the safety and risk management aspect. The other aspect is that pretty much everybody has an artificially limited bed capacity because rooms are being separated units are being separated into COVID and post-COVID. So you create an extra bottleneck. The example he gave was, I think I have 8 patients boarding in my ED right now, even though my hospital is half empty because we don't have enough non-COVID rooms. And so even though, throughput is not, or as pre-COVID, throughput was not an every hospital problem necessarily because some hospitals have problems getting heads in beds. But now because it's a risk issue and because there's artificially fewer beds, it's becoming more of a priority. And the other thing that brought up was we need to find a way to reestablish public trust and patient trust. Otherwise, nobody's going to darken our doorstep.
Yeah.
And we're not going to be able to recover from the revenue losses. So that was just kind of one of a couple of interesting tidbits that we're chewing on.
So it seems like a no-brainer, but I think it's worth reinforcing for our viewers and listeners that your pivot strategy process started with customer discovery.
Right. Going back and saying, hey, how are your priorities different? And
Yeah.
what is actually getting budget right now?
Yeah. So you didn't just, kind of congregate and come together with your team within your organization, but your natural inclination was to include prospects or customers in that discovery process.
Right. Right. So in this discovery process, we actually another physician he's been around at the Children's Hospital for a long time, very influential. He said, I can see from what you're doing that it would make my life a lot easier, but I've rarely seen the hospital spend money on making my life easier. I have seen the hospital spend a lot of money and more money every year on improving the patient experience. So even if what you're doing is going to make my life easier, I would frame it as a patient experience first and provider efficiency second. Because provider efficiency is kind of squishy and doesn't necessarily show up on the balance sheet, but patient experience is less squishy.
Yeah. And so how valuable is that?
Yeah, no, for us, it's been really valuable to start to look at, okay, hospitals are like, inpatient stay is like a black box for providers, but also for families. If you're, especially now when you can't go visit a loved one, and even, pre-COVID, family members, if you had a patient in the hospital, if you had a loved one in the hospital, you felt like you had to be there 24/7. Otherwise, you're not going to have a clue what's going on. And not only that, if you're there, nurses and doctors are going to ask you, hey, what's going on in this patient's care? Because as we've already discussed, they don't have a whole lot of visibility into what other care team members are doing.
Sure, right.
And this is something that actually my two co-founders have experienced fairly recently with loved ones. One of my co-founders had his mother-in-law in the ICU for a while. And we started thinking about, well, what would it be like if you could, as a loved one, have transparency into and stay updated on the key events in care and know, like UPS tracking, like, is mom in the ICU? Has she been discharged? Has she been scheduled to go into the OR? Is she in the PACU? Where is mom and what is being done to her? And so that's something that we're looking at right now. As it happens, our CTO already had previously built the architecture that would make it possible for a loved one to open a secure connection, for a patient to open up secure connections to loved ones to see updates on their care. Mm-hmm. The main challenge right now that we're looking at is, patient portals aren't new, and the idea of updating families isn't new. Yeah. Epic My Chart Bedside has a feature where you can share a pin with loved ones so they can get updates on things like your test results and stuff like that. But when you actually dig deep and look at, these things have app reviews on the iTunes Store or on Google Play. Adoption is really low, and patients, it's not user friendly, it's buggy. And we're thinking, hey, even though the elephants in the room have a solution to this, or have at least checked the box for a solution, maybe it's still worth putting something out there, because when I think of consumer-centric healthcare, I don't think of the legacy players. I don't think of them as leaders in being consumer-centric when they can't even really be clinician-centric. Right. So, they struggle making things user-friendly for highly educated people. Are they really the right people to make something user-friendly for a layperson who maybe has a third grade reading level? Yeah. Or, who was really tired and sleep deprived and just went through a major operation. Mm-hmm. So that's we haven't come we're still in the process of looking at the competitive landscape and trying to see, well, do we really have an unfair advantage here with our when we're looking at our expertise in human-centered design and interoperability. Or is this going to be the kind of thing where we go to a health system and say, well, Epic already does this. Do we really want to be in the position of saying, well, we do it better? No,
right.
That kind of that generally doesn't go over well.
Not when the health system is paying all that money to Epic. They just said that they're going to wait until Epic adds it to their platform or improves it. I hear that, consistently. So let's talk about how COVID has impacted your company financially and in some of your exciting new developments.
Yeah. So when COVID hit, when our product got put on pause, we just said, you know what, we're going to freeze our expenses. We're not going to run payroll until we know like what's going to happen, or until we get some kind of new business prospects or something signed. So we just wanted kind of a little bit more clarity, but we decided to say, what the heck, let's try to raise some capital, because we do have some exciting things in the pipeline. They haven't come to fruition yet. And so we pitched to a local angel group. And yesterday we found out that there's like a screening process. So you do an initial pitch, and then you're invited to present in front of like the general member meeting. And then at the general member meeting, angels who are interested, they raise their hands and they say, okay, I'm gonna put in $25K, and these 10 of my buddies are also gonna put in $25K or whatever it ends up being, and they form a syndicate. But it was interesting because we didn't know what to expect really as far as investor sentiment, because there's been, if they had money in the stock market, they don't have it anymore.
Right.
So we were saying, hey, we're going to do this conservative raise. Our expenses are going to stay conservative for the next couple of years. We're going to try to use this little bit of money to get to cash flow positive with this handful of customers. And the response that we got was, healthcare is doing a reset right now. Are you going to miss out on that opportunity if you don't raise more money? We think you should be raising more money. And we're thinking like, well, if you really want to throw it at us,
exactly.
We're not going to stop you. but at the same time, we're kind of optimizing around, we don't want to spend too much time if we have a more ambitious ask. We don't want to be struggling to get that last $50,000.
Sure.
Right? And we're still pre-revenue. We're going to take a hit on our valuation from that, even if we're only like 2 months away from potentially having revenue. So
sure. Yeah.
Let's raise a little bit of money now so we get some breathing room and have the freedom to spend on marketing and product development. But we're still kind of going to kick the can down the road until there's, fairer weather.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So congratulations. That's very, very exciting. And I speak to health innovators every week in different phases of the innovation process, some still raising money. And I've not talked to one person that's pitched anyone in the last 60 days.
Yeah.
And so I think that it's very inspiring and very encouraging, and as you and I were talking earlier, there's so much uncertainty with the market in the perception, and I think that it's happening, is that, funding's dried up and, people can't raise money right now, and especially angels. like,
Right.
maybe PE firms, but, not an angel. Like, that's just not happening. And, you're a testament to like, not really, like it is happening.
Yeah, so it's funny. I'll just share one of my mentors who's an angel. He gave us one of our first checks. He said, during recessions, yeah, you might take a hit on valuation and maybe there's a little bit less liquidity out there. But if you're an angel investor and you're wealthy and retired, what else are you going to do with your time?
Right. I
was like, that's a kind of an interesting way of putting it. It's like,
you're like, I need more people like you in my life.
Exactly.
Oh, yes. So it's very, very exciting. And, I'm not an investor, but I'm more of like a futurist. I'm always forward looking. And like you and I were talking about before, the amount of, acceptance and adoption in digital health, like we've leapfrogged 5 years worth of that growth curve in the last 60 days. And I don't think we're going back. We might recede a little bit, but if I was an investor, I would be banking on that now. I would be getting in because it is more promising. The outlook is more promising than ever before for this sector in healthcare. Yeah.
I completely agree. And one of the things that we're doing to try to capitalize on that faster is think outside the box about who our potential partners could be. And as it happens, because what we're doing is basically like a custom health information exchange with data visualization and analytics layered on top, there are other people who maybe need the same data that we're working on getting access to for different reasons.
Yeah.
So we're looking at we're in conversations with a big company in the healthcare analytics space that is still getting data from its customers by getting flat files pushed to them. Which is a very 1980s way of doing things. And we were immediately interested when they told us, hey, we've talked to InterSystems, we've talked to Redox, we've talked to all the established players, and no one seems to have a right-sized or custom solution to this. Everyone either wants to push us something that's really one size fits all and doesn't make sense, or they want to charge us an arm and a leg to solve this problem. And as we dug deeper, we discovered, the data that they're interested in pulling, there's like 80% overlap between the data they need and the data we need. So there's an opportunity here for us to license just a portion of our technology to them and potentially get implemented in 600 hospitals in one fell swoop. And then, even though it's not all of our technology in those hospitals, if we wanted to sell them and they said, well, what does the implementation look like? Well, we'll say, well, we've already implemented the hardest part because we already have the data exchange framework ready. It's just flipping a switch to put this other add-on in.
Right. Yep. So I think, I've talked about this quite a bit recently, is that, now is this window. I mean, I think that we can always be creative. We can always rethink and reassess how we might do things in business and all different levels, both like sales, marketing, market strategy, et cetera. But now when people have a tendency to slow down a little bit and have a little bit more time on their hands to rethink and assess, or just whether I have time or not, I'm making time to pull back and figure out what does this mean for me going forward, that we are going to see so much creativity come out of this situation, that so many things will be birthed, that it's a very exciting time for that type of process to take place.
And one of the things that we've realized is that, okay, things might be crazy on the provider organization side, but folks who are maybe in insurance or who are other software vendors, they're probably bored out of their minds at home maybe there's a little bit of chaos, but it's nothing like being in a provider organization right now.
Right.
Now is not a bad time to have an open-ended discussion with those people about, here's what we were doing pre-COVID for hospitals. There are these aspects of it we think might be relevant for your business.
Yeah.
What do you think?
Yep, exactly. So, being an entrepreneur is a very challenging career choice, right? It takes a lot of resilience. So what are some of the ways that you are staying motivated these days?
That's a good question. I think part of it is like, you have to recognize that there's going to be days where everything sucks and you want to throw in the towel. But I try to take the perspective of, okay, today everything sucks, but I still have that conversation scheduled for 2 weeks from now with so and so, and there's a lot of potential there, and there are these other things that we've got going for us, and just kind of step back and realize, like, I'm not always going to feel this way.
Yeah. Yep. Absolutely. And it's really that resilience that I think is the big difference. I was listening to a podcast the other day, and I don't remember the name of the person, but they were reiterating a story of, I think, a famous swimmer. I don't know, she was traveling around the world. Swimming around the world, swimming from one country. It was a pretty long swim. It was some kind of incredible swim. And it ended up being foggy. And she gave up about 20 yards before the shore.
Oh, no.
Because she couldn't see the end. And so, they were making the analogy that majority of the people give up because they can't see what's next, but they give up right before that they're about to win.
Right.
And so, the ones that succeed are the ones that keep going, right? You put 80% of the effort in before you start to see any kind of return.
Right. I'd say it's way higher than 80, but yes.
She's like, it feels like 101. So who've been the most influential in this career, in this endeavor?
Most influential people in my life. Well, as it happens, my older brother is also an entrepreneur, except he's a rocket scientist. So
come on.
He's building tools to make jet engines more efficient, which is a very, very long path. Another highly regulated industry, lots of concerns about safety, and so that. It's a really R&D heavy endeavor, and so I'm just really impressed with how he's stayed the course. But
that makes for really interesting conversation at family dinners.
Yeah, it does. It does for sure. There have been a few physician executives who were kind of near the end of their careers who have taken me under their wing because they realized, hey, this girl has new ideas about the way we've always done things. And so there's a chief medical officer that is brilliant. He's an applied mathematician and an electrocardiologist. And he was the one who had kind of the first most blunt conversations with me while we were doing customer discovery. And it was really interesting. Early on, we kind of had this idea that, what if we could be like Amazon in your EMR and use predictive analytics to figure out what providers want to see next. Part of this conversation was when we realized that was a terrible idea, even though I know there are companies that are doing that. And the point he brought up was, that sounds really cool, but we struggle with the basics. We can't figure out who's taking care of our patients, what problems are being actively managed right now, or what medications they're really on or not really on. So if you could address the basics, that'd be great, and leave the sexy fancy stuff for some other time.
Right.
Because it's not really that relevant right now. And actually, that was, to us, that was really an aha moment, because we looked around and we realized, yeah, there's lots of people trying to do really sexy innovations in healthcare. And I'm a biomedical engineer. I'm all about the, deep brain stimulators and tissue engineering. That stuff's all cool. But what about getting the basics right?
Yeah. And surrounding yourself with truth tellers like that is a game changer.
It really was, because otherwise, we would have gone down the path of trying to build some fancy predictive analytics engine, and then later on realized, oh, you know what happens when you tell clinicians that you're gonna figure out what's relevant to them and constrain their view of a patient? They're gonna worry that, oh, what are you hiding from me? What is your algorithm not catching? Mm-hmm. Whereas if you just change the way data is organized and change the way you can search for things, then you're empowering them to catch their own fish.
Yeah, absolutely. So I want to go back to this investor pitch. So how was pitching today, post-COVID, different than pitching before?
Honestly, it surprised me that it didn't feel that different.
Okay.
It didn't feel that different, other than there was a lot more, I guess, bullishness around healthcare is changing. Let's get in now. Mm-hmm. As we were preparing the pitch, we're like, oh crap, we were about to get traction, and now all we can say was, before coronavirus, we were about to get traction, and oh yeah, we have these ongoing conversations which make it feel like we're about to get traction, but guess what? We don't have traction.
Right.
So in our heads,
not very many ways to spin that.
In our heads, we're like, you know what? Here goes nothing. But it went over way better than we expected. And I think part of what we lost sight of was that angel investors, to a certain extent, can invest more on a gut feel necessarily than VCs, and they generally become angel investors for different reasons. Mm-hmm. They might be old enough that they may or may not actually see the fruits of the investment. No, so it's just different, the reasons people get into it, which means I think if you have people might be buying more of the mission than how is this going to make me money. Although how is this going to make me money is a filter. Yeah, absolutely. So what advice do you have for fellow entrepreneurs that are in the trenches right now? What are just some of the lessons that you've learned already? I would say think really hard if your core value proposition is efficiency, because you will find people in the health system who all they care about is efficiency, and that can blindside you, because when it comes to the people who are most influential in writing checks, they don't see efficiency on the balance sheet necessarily. They see revenues. And so if you're not, whenever possible, if you can have something that says this is going to directly make you more revenue, that's much better than the efficiency. And that kills me to say, because we know billions of dollars are being wasted. It's just, it's somehow ephemeral.
Right.
To administrators. The other thing is, I think we personally overestimated the importance of clinical champions. And by that, I mean, clinical champions are necessary, but not sufficient. But they're also not wizards, and they also might not be as familiar with all the with the way the decision-making sausage gets made when it comes to administration. And that a lot of times has to do with the fact that in hospitals across the board in general, there's a lot of friction between clinical leadership and administrative leadership, and they don't necessarily see eye to eye on priorities. So if you have, it happened to us that we had just we had clinical champions that were just effusive in their praises of us. And so we kind of, we kind of got all excited about that.
Well, here we go.
We got all excited about that, but what we didn't realize was that will only that will only get you a seat at the table, but it's not a guarantee that administrators will see eye to eye.
Yeah. Yep, absolutely. And I think that that's part of the complexity of selling into healthcare is that, all B2B or most B2B sales have a myriad of stakeholders. And, I think that each value proposition is really important and very critical. And sometimes we can get caught up in the value proposition for the patient or the value proposition for the provider and forget about the patient and vice versa, or the one writing the check.
Right.
So being really clear on who the stakeholders are in that buying process and the value proposition for each one and knowing when and where to use each one, I think is so important. And it just makes that sale in healthcare so much more complicated.
Right. We discovered efficiency is a great value proposition for providers. It's, as you kind of move up in the administrative chain, it gets less sexy.
Yep. Yeah, absolutely. Well, Anna, thank you so much for your time today. I really appreciate you sharing your wisdom. Always like to give you an opportunity to share your contact information with our listeners in case anyone wants to get a hold of you after the show.
Sure. You can reach me via email. It's anna@surefhir.co. And I guess you can leave that in the comments or ping me on LinkedIn, Anna Gomez del Campo.
Excellent. Thank you so much.
Thanks, Dr. Roxy.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app, like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.